when you look at a patient with, 4 or 5 medications, and each one of those medications, you have, the patient calling in for a refill. You're moving that prescription through data entry, fill, verification, will call, notifying the patient, having a point of sale transaction or delivery. That's 7 different touch points on one prescription. So with 4 prescriptions, all of a sudden you're up to 28 touch points. It's hard to decide which one of those 28 touch points is going to be the one where you get clinical and concentrate on a med rec and concentrate on, really moving the needle in other areas. So definitely that mid-sync so important.
Yeah, and I think it gets to that appointment-based model too, and then that chance to have that interaction with the patient to see how they're doing, right? To get information from them about how are things working? Are you having problems? And by scheduling that every month, then you're definitely going to have that conversation with them. So I agree. I'm glad you touched on the technology part, because one of the reasons we are still baby stepping with MedSync is because we have tried and failed with other systems in the past. And it was very frustrating. And then it's hard to convince your team, okay, we're going to do this again. But it is working now. And we're very pleased. It does take patience though. So for anyone who is just getting started, let's encourage you that don't give up. Don't give up. Like the beginning is probably one of the hardest times. So just, set a goal, 5 patients a week, whatever it is, set a goal and just keep persisting. And there will be patients that fall off that program, and that's okay. You're going to have failures. That's okay. Not every patient's a perfect candidate for sync, but keep it up.
Yeah, so there's definitely a point where it tips, where if it goes from having a difficult change, because any change is a challenge. So there's a point where that starts to pay off at a certain percentage. When you get around 25, 30%, I guess it starts to all of a sudden clear the schedule a little bit. So when you do have that appointment-based model, what benefits does that give you practically with the patient? Like, how are you capitalizing on that appointment-based model, and what services are you able to offer in that appointment?
So one of the things you could do is if they do have a medication therapy management opportunity, then that's a great time to catch them then. And do that. Also immunizations. And I will be honest that we're not as good at that as I wish that we were, but that's a great chance to, to speak with them about what they're current on or what they might need to have. So those are just a couple of examples of things that, you could add in at that appointment-based model. But I also think just having that question, are you doing okay? Is there anything going on that we need to know about? Because, we can make an impact in their care that way too. Perhaps they do need a change in medication. So, that's the chance for the pharmacist. If the technician who's calling finds out that there's something going on with that patient, then that's a handoff to the pharmacist to have a little bit of a deeper dive as well.